Justin Sunshine, who was a managing director at General Atlantic, which is one of the largest PE firms in the world and certainly among the most global. General Atlantic makes only growth capital investments. It currently has 127 companies in its portfolio, $40 billion under management. And healthcare is one of only 4 industries in which it invests. Justin is a healthcare specialist at General Atlantic, and obviously very much in touch from an investor's perspective with the evolving healthcare ecosystem.
Great, thanks, Ken. And it's great to go after so many diverse perspectives there, and come with mine, which I can provide more on our healthcare portfolio and the investment prospects that we've been looking at. And so just a quick note of my background, I'm a partner at General Atlantic. As Ken said earlier, we're focused on growth investments. I'm focusing growth investments specifically in healthcare and healthcare technology companies. Quick on General Atlantic, we're a 40-year-old firm focused in growth equity, focused in providing capital and strategic support to growth stage companies. We're partner, we're pretty hands-on, partner with our management teams, and we basically sole goal to helping them build great innovative companies. A big focus on technology, how to utilize technology to evolve business models, differentiate our companies, which, with the topic du jour today, it's been very exciting through the pandemic, as the landscape has shifted and, adoption and receptivity and regulation has shifted, which I'll talk about, has made that a more exciting and dynamic time to be investing and, working with our companies to take advantage of those opportunities. Within our portfolio at GA, we have deep experience in healthcare, a large portfolio across the healthcare ecosystem. We have payers, we have providers across a range of specialties. We have pharma services companies, and we have invested in the therapeutics themselves. So pretty well-rounded portfolio and purview, and also global in nature as well. We're a very global firm, big presence in the U.S., which is where we were founded, but also in Europe, South America, India, Asia as well. So I'm going to spend some time today talking about how we've seen the healthcare models evolve, both in our portfolio and in investment prospects that we're looking about, specifically through COVID, and how we think it impacts the outlook for those companies and the investing landscape as well. So there's been some discussion so far here about, especially in the first presentation, about the rise in virtual care through COVID. And it's certainly true. There's been real success across a number of different care types, which I'd say we expected was there, and we think represents more of a acceleration of virtual care and its integration into the healthcare ecosystem. We've posited a thesis for a while that virtual care will and should play a big part of the integrated healthcare network, and this acceleration is really helping to prove that's the case. That's true in all types of virtual care. I'll kind of bucket it into a couple of different types. One big one, and perhaps the most obvious to folks, would be telemedicine players. So entire business models that are built around engaging with patients and providing care through utilizing virtual tools. And a big primary care focus to that was already a very meaningful trend before COVID. But we've seen a rapid acceleration of adoption because due to the necessity of needing to avoid in-person interaction. With even wider adoption, it's now been seen as very effective, very convenient, very cheap versus needing to maintain diverse physical endpoints for perhaps healthcare encounters that didn't require it. And so we expect that will continue to gain ground whenever things eventually do become normal again. We recently invested in a company called Doctor on Demand, which does exactly that. They have a particularly effective care model, which we like and we think is poised to continue to grow very well. Other types of virtual healthcare, kind of have similar attributes. They're not just the full virtual care model who said telepsych, chronic care management, finding virtual tools to help people manage their chronic conditions, remote patient monitoring, which can be part of that chronic care, which was talked about earlier on the panel, digital pharmacy, finding ways to get pharmaceuticals to people at home, and models to create efficiencies through other parts of the ecosystem, clinical trials, pharmaceutical commercialization, all of that. They were all gaining traction pre-COVID, and I think we expect we'll see continued acceleration for a long time. I think the most interesting aspect to me is another one, which is existing brick and mortar providers who now have ways to use virtual tools to extend their traditional offering. The pervasiveness of this is much more of a new phenomenon than some of those other models, which did exist but didn't have as much traction before. This is basically allowed those providers to maintain engagement with their patients through COVID, with all the same convenience and efficacy attributes that I talked about with the fully virtual models. Our entire provider portfolio has made that technology shift and did so rapidly. Some as much as 80 to 90% of their previous volume shifted virtual extremely quickly. And that's not just primary care. It's all over the spectrum in areas where it typically was not virtual. Specialties like oncology, where we own a company called What Oncology, that's a MSO for medical oncologists, and behavioral therapy, which I'll come back to later. And we have an autism therapy business that provides behavioral therapy one-on-one to children with autism, not something historically done virtually, but has been actually very effective, which I can touch on. And so there's these type of brick and mortar providers shifting. There's been a bunch of barriers to that happening historically. There was skepticism in pockets of both the provider community about whether this would work, whether their specialty could work through a virtual channel. There's skepticism in patient bases, and the same thing. This is such a physical field, healthcare. The idea that you wanted a relationship with someone, you want to see them in person, you want them to be able to see, inspect, all of that, those barriers, which we expected in the long run would be broken down out of necessity through COVID, have had to. And just back to the autism therapy example, both on the provider and patient side, client side, in autism therapy to young children, you'd expect that there's no real, technological way to provide that type of teletherapy. And we found hugely effective, especially the supervision of the cases, of the actual, individual therapy sessions done, and actually the direct therapy as well, has actually been effective. And again, out of necessity to ensure that there are not setbacks in individual children's progress in skills acquisition using the therapy, the virtual tools at our disposal have actually been really effective. So very, 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 exciting times there. The other big barrier, aside from just skepticism, perhaps from providers and patients, has been reimbursement regulatory frameworks. Emergency regulatory initiatives were put in place now to ensure that people had continuity of care across specialties that didn't have virtual tools, created frameworks. A lot of the commercial insurers have followed suit. That includes obviously extending the reimbursement to ensure that the virtual services can be available to the new specialties, but it's also things like relaxing requirements around the doctor and the patient having a pre-existing relationship. That was something that was often true for certain channels of telemedicine, and also expanding the type of technologies that can be used. So that, without the benefit of prep time, now people were allowed to use in certain situations FaceTime or Zoom to conduct telesessions, which that's only one part of this virtual care arrangement, but it was just a groundswell of let's just make sure that we don't have gaps in care because of COVID. Most of that was seen as temporary measures, but the success of the treatment modality overall, I think, should make a lot of these changes permanent. And the most interesting dynamic is, without COVID, there would not have been a burning platform to try this, and so much scale and so much diversity of locations, with so much diversity of populations and so much diversity of specialties. But since we've done it, and we already have 6 months of data now, you can just say, did it work? In which places did it work and not? And that longitudinal data set on outcomes and efficacy, on patient provider satisfaction, on how the system works, which was probably clunky out of the gate because of the lack of prep time, I think it is compelling enough in most cases that it will be used to shape future reimbursement models that maybe would have been several years out. And again, that's before mentioning the improvements in engagement and patient satisfaction from the channel, which was a barrier. And as I said, I think people have realized that there's a lot more use cases than perhaps they previously realized. So quickly, from an investment perspective, what all that means, we're looking for companies and opportunities with our own companies where they can use this new reality to innovate their business model. And whether that means expanding into new geographies faster or reaching rural geographies that were previously untenable because the local on the ground dynamics didn't work from a provider standpoint, better utilizing the clinical workforce, which is critical given their provider shortages in a bunch of specialties. This could create a lot of new capacity for the healthcare system, which is great news. And then creating more engagement with patients to bend the care curve to earlier preventative checkpoints. The more you can use virtual tools and the burden of actually engaging with the healthcare system goes down, that's great. You don't catch things that are such late onset. So our model at GA is to really partner with companies, and I expect we'll be spending a lot of time, and we already are, in the trenches with management teams on exactly how to seize these golden opportunities to change the way care is delivered, even beyond COVID as things return to normal.